Hello, come in. Nice to meet you. My name is Doctor Zara, and I believe you're here for just a general health checkup today. Good. Okay, so come on in. So just the formalities first, okay? That's all right? Good. Okay, so if you can just confirm your name. Great. And your date of birth. And if you can just confirm your address for me. Great. Okay, so how are you feeling in general? Okay, good. So if I could just ask you a few questions first, just to go on your medical record for today. So are you on any medication, any prescribed or any over-the-counter medication? Okay. And do you smoke? Okay, good. And do you drink any alcohol? Okay, and how many units would you say? And is that daily, weekly? Okay. And what is your fitness like? Okay. And how are you sleeping at the moment? What's your sleep routine and pattern like? Okay, good. So how are you feeling in general? Any pain or discomfort anywhere? Everything's fine? Okay. And what about your mental health at the moment? Okay, good, great. Okay. Right, so looking at your notes, you came in and had your blood pressure done just last week, actually, yep, that looks all good. I can see that blood pressure is fine, so blood pressure's fine there. Okay, so I'm looking, you had your bloods done as well, is that right? Yeah? Okay, so yeah, nothing's come back on those, they're all clear, so that's fine. Okay, so let's just start with your temperature, if that's okay. So this just goes in your ear, okay? So just wait for it to... Okay, are you ready? Just gonna go in this ear here. Okay, yep, that's absolutely perfect, 36.8. 36.8. Okay. So I'm just going to put my gloves on. How's the traffic getting here? Good. Okay. And if I could just have one of your wrists, I'm just going to take your pulse, please. Okay, if you just hold still, I'm just going to use the clock up here. Okay, pulse is fine, absolutely normal. Okay, so can I just start from the top if that's okay? So I'm just going to have a look at your face to start with, just make sure that everything is symmetrical. That's it. Okay, and if you could just tip your head forward, I'm just going to check your scalp as well. Okay, that all looks fine. Okay, yeah, everything looks fine, I think. Everything's symmetrical. Yep. Okay, so now we're just gonna do your eyes. So first of all, if you could just cover one eye, and then if you could just read this line here. That's great. And then if you swap eyes and cover the other eye, and then try again. Okay, and did you have any blurred vision or discomfort in your eyes when you were doing that? No? Okay, great. Okay, so if you could just look at my nose, and then if you could just tell me when you see my hands come into view. Okay, good. And which one am I wiggling? Good, and again. Wonderful. Okay, and then if you could just look at me again. I'm just going to use my torch. And then if you could look up to the ceiling, please. And if you could look down. And to the side. That's it, thank you. And to the other side. Okay, and finally back at me. That's great. Okay, and then just look at my hand. Great. Okay. Okay, and then if you could just look at my pen. That's it. And then look at the wall. That's great. And then look at my pen again. And then look at the wall. That's great. And then just back at my pen again, please. And one more at the wall. Thank you. Great. So everything of your eyes looks absolutely fine. Just do one more. If you could just look at my pen once more. If you could just follow. Great. Okay. So, what we're going to do is we're going to move down now. We're just going to look at your nose. So, if you could just tilt your head back so I can look up your nostrils. I'm just going to shine this light up your nostrils again. Okay. That's it. Keep your head tilted back a minute. Okay. Any issues with your nose when you have a cold or sneezing? No? Good. Okay. And then we're just going to go down to your mouth. So if you could open up wide, and I've just got this. I'm just going to put it on your tongue and I'm going to look at the back of your throat, okay? So if you can just go, ah, that's it. Okay, and just go, ah, good. Well done. Okay, so any issues with eating or swallowing or any issues with your teeth? No, that's great, okay. And I'm just going to have a feel down your neck on your glands, okay? So if you could just sit up straight, that's it. Okay, I'm just going to feel. So no visible bumps, or I can't feel anything there, and your glands feel absolutely fine there. Just going to feel up to your jaw. that looks fine. Okay, so I'm just going to have a listen to your chest, okay? So if you could just pull your top down a little. Okay, you ready? Wonderful. So just going to put this on your chest here. Okay, if you can take a deep breath in and hold and out again. Thank you. And breathe in again and hold and out again. Thank you. And once more, if you can breathe in and hold and out again. Good. Okay, and if you could just cough. Thank you. And cough again. That's great. Thank you very much. Okay. So I'm just going to go round and do that again on your back, okay? Okay. So if you could breathe in and hold and breathe out again. Okay, and again, if you could breathe in and hold and out again. That's great. Thank you. Okay, so all sounds fine in your chest. Have you had any chest infections before, or no? No, it all sounds fine there. Okay, so right. Okay, so I'm just going to feel down your ribs while you breathe in for me. So if you could just take a deep breath in, and I'm just going to feel down here and breathe out. Okay, and breathe in again. That's it. And out. Great. All fine there. Okay, and then I'm going to move down to your arms now, okay? So you're just doing great. Okay, wonderful. So if you could just pass me your arms, that's it. I'm just going to check. So they both look fine, and your skin is a great colour. Okay, and can you feel me there? Yep, and can you feel me here? Yep, great. Okay. So do you have any abdominal pain in your tummy or down below where your bowels are? No? Okay. And what are your bowel movements like? Okay. And what about your urine? Are you making sure that you drink enough? Good. Okay, that's fabulous. Yeah, it's always advised to make sure that you're drinking plenty throughout the day, especially when the weather gets warmer. Okay. And then how about your limbs? Any pain in your limbs or your extremities, your fingers or your toes? No? Okay, good. Okay, can you just move your legs for me? Okay, and then just shake your fingers. Good. Okay. Fabulous. So, generally, your health looks absolutely fine. Okay. So, just going to review these notes here. You just take a seat a minute. So looking at your current prescriptions, they all look fine. And we'll book you in for another 6 months and we'll do another checkup. Okay? And in the meantime, if you need to come and see us for anything, then do feel free, just ring up the reception and they'll be happy to book you in. They will just ask you for a brief overview of what you're calling in for. And if need be, we can do a telephone consultation. Okay? But thank you very much for coming in to see me today. Have a good day, okay?